Hi everybody, it's Dr. Alasio here at Intentional Self Aesthetics, and today I'm going to break down some common myths associated with injectables. So myth number one, injectables will make me look fake. So a lot of people think that injectables will make them look fake. That injectables, especially Botox, will make them look frozen or overdone. And this is, comes from a fear of people feeling like they're not going to look like themselves anymore. This is very injector dependent, and the truth is that, we want you to look like your best self. We want you to look refreshed. We want you to look rested, and we don't want you to look overdone or not like yourself. And we don't want your friends and family to say, oh, did you have work done? So we want you to go out looking like the amazing person that you are. So that's myth number one. Myth number two is once you start doing injectables, you can't stop. This comes from the thought that if you are doing Botox, that you just need to keep doing Botox like forever and ever, or else something is going to happen where, it's going to destroy your face, it's going to ruin your face. Or if you keep doing, if you're doing filler, then you just keep needing to add filler, or that it becomes addictive. This is very common as well. And the truth is that if you stop doing Botox, if you stop injecting Botox in your face is just gonna go back to normal. The Botox will wear off. The filler will eventually dissipate and kind of dissolve on its own, and will have no effect. You can stop anytime you want. Myth number three, Botox and filler are the same. This is also a common myth, and the truth is that Botox is something called a neuromodulator, meaning that the mechanism of action of Botox is on the muscle. It is a muscle relaxer, and that's how it works on to dispel wrinkles. Filler is an injectable substance that occupies space in the skin and in spaces where there's skin laxity. So you inject filler, which is usually composed of hyaluronic acid. It could be composed of other things, but pretty much the filler that we're talking about here is hyaluronic acid. So that does not act on muscle in any way, shape, or form. So it's a very different objective than Botox. So there are very big differences in Botox and filler, mostly on their mechanism of action. Number four, I am too young or old for injectables. So some people think that they are either too early or too late to the party for injectables. And really the truth is that there is no perfect age. There are people that do Botox injections in their 20s and at doing it that young, preventative purposes. And there are folks that get injected with Botox or filler in their 50s or 60s. There's no perfect age to try injectables or to continue doing injectables. Injectables can be a complement to other procedures that you may do, like microneedling or radio frequency treatments such as M-Face. You can do them throughout your whole life, as long as you want. Number five, results are instant. Well, this this is true to a point, but ultimately not true. So with Botox, you do not get immediate results. We usually tell clients that it takes up to 2 weeks to fully set up Botox, but you can actually see results from Botox as little as 3 to 5 days. But if a client comes to me and wants a touch-up before the 2-week period, I usually tell them that they should wait the full 2 weeks. Filler, on the other hand, will show an immediate result, but filler also needs a little bit of time to settle down. What happens with filler is that it will swell because hyaluronic acid is hydrophilic, which means it loves water. So it absorbs water. And so anything that absorbs water, like a sponge, it swells. So if you get filler in your lips, the first thing that's going to happen is that in the first 24 to 48 hours, your lips are going to swell a lot. This is what I tell clients all the time. And I usually tell them that your lips are going to swell like you got stung by a bunch of bees. And then what happens is that stays that way for a period of time, really up to a week for lips, and then it settles down and that swelling goes away. My advice to folks who are interested in getting filler is that they should plan ahead. Don't do any kind of injectables, especially filler, and also Botox to a point within 2 weeks to a month of going to any kind of special event, such as a wedding or trip, vacation, etc. Anything where you're going to be seen, have pictures taken. If you're going to a family reunion or a high school reunion where you're going to see people that haven't seen you in a long time, the last thing you'd want to do is go and have people see you in a state of complete swollenness. So plan ahead with your injectables. That would be my advice to you and to any client that comes and talks to me. Myth number 6, injectables are dangerous. So many of us have heard scary stories about what's happened with injectables. There have been stories in the news, there have been stories on TV, I've seen them, we've talked about them. I think that addressing them is the best way to bring these things to light. What I can say is that bad things happen when you have providers who are not licensed or trained properly. Providers who use products that are suspicious, that are not FDA approved. You can get fake Botox from Alibaba, which I've heard, which I do not get that kind of product. Always choose your provider very carefully. Make sure that you're using product, or that provider is using product that is FDA approved. You can even ask to see the vial if you want. See a provider that you trust. You can question your provider always. Ask them how much experience they have. Ask them if they've done this before. You can, any provider worth anything will welcome your questions and your inquiries. And, nobody's perfect, that's for sure, but all of us who are trained and have the backing to prove it will do our best to make sure that when you put your trust in us, that it is well-founded. The last one is a myth that once you get an injectable, it's one and done. And the truth to that is that injectables don't last forever. Botox or any kind of botulinum toxin lasts about 3 to 4 months, and then you need to have a repeat. So you're probably getting Botox regularly. You're probably doing it like 3 to 4 times a year. If the last time you got Botox was 5 years ago, pretty much it's worn off. So I've seen that when clients have come to me. I ask them, when was the last time you got Botox? And they'll tell me, oh, the last time was 3 years ago. And I'll tell them it's pretty much worn off already, and they're surprised. Filler lasts anywhere from 6 months to 2 years. So, and actually there's some evidence to show that filler even hangs around for up to 5 years. In my office, I have an ultrasound to detect the presence of filler, and we can actually see if there is some residual filler hanging around in either lips or cheeks or wherever people have said that they've gotten filler in the past. So, you pretty much know that filler and Botox do not last forever. They, like any kind of skincare or fitness, it needs maintenance. You need to keep up with it if you're going to benefit from the look. If you like the look, you should maintain it. If you don't like the look, you can always stop. That's your choice. So ultimately, this is all anybody's choice. We as providers are here to give you the best look that you want. We're here to give you the look that you desire, to make you look, to help you look refreshed, to help you look your best self, and to do it safely and in the most easiest and most comfortable way possible. If you want to know more about injectables or any other kind of aesthetics procedure, especially the ones that we do here at Intentional Self Aesthetics, you can give us a call or go online to our website and check out and see what we do and make an appointment for a consult. So thanks, and see you soon, I hope.